one of our friends, his name is Fatul. He has this issue where there's actually a growth underneath the skin. There's a term for it it's called carbuncle. It's actually abscess growth underneath the skin, but somehow this growth is actually pretty quite deep underneath the skin, probably around the within the flesh itself. Now, the next photo that I'm going to show may be very shocking for some of you, or maybe even all of you. Now, this is him. What happened was that growth actually became infected, and there's a lot of abscess that's gone on deep inside the flesh. And he actually went to see a doctor, and the doctor immediately did a check on him, did a scan, and true enough, the growth has actually went in quite deep into his flesh. And immediately, the doctor advised that he needs a surgery immediately, because that sort of growth it was actually very near the spine, and if it had gone to the spine area, it would have even been more complicated. Could be life threatening if he's to go under a surgery to get all these abscess growth to be removed. So this was him on the day of the surgery itself, just after the surgery, where the doctor actually carved out a whole chunk of flesh from the back of his neck to remove all the abscess. Now, the dark parts of the wound, you can see, are actually burn wounds, because they actually have to burn some of the capillaries to prevent bleeding, to stop the capillaries from bleeding further. And you can see that there are a lot of pus. So all these pus had to be removed, and all the abscess to be removed. So this was eerie experience. And whenever when I showed this photo to some of my friends, they think that, hey, this is a Photoshop, but it is not. So this is actually really what happened. A big, large gaping hole had to be carved out from the back of his neck. Now, for the next few days, that wound had to be covered up, of course. But every 3 days, so he was already discharged. The doctor let him go home, but he had to have a patch over the wound, because it was still a deep hole, and he had to have a tube attached to it. So it looks just like Matrix. Now, every 3 days, a nurse would come to his house and use a vacuum to actually suck out any abscess or pus that are still within the flesh itself. So on the right, you see still a large gaping hole, a deep hole after the vacuuming has been done. So this has gone on for about a few weeks, and he was introduced to Asea and Renew. So one of my friends, who is actually his friend, introduced Asea, and so he started drinking it, started applying Renew gel, not on the wound directly, but just around the wound itself. And upon starting consuming Asea, he noticed that he has more energy, and the flesh started to grow back, and it was actually growing back at quite a rapid pace. And this is the photo just a couple of weeks after consuming Asea. You can see that from a deep hole, flesh has started to grow. You see less and less of inner flesh, and you start seeing more reddish patch. So this is a new layer of flesh that has grown, new tissues that are growing healthily. Even the nurse was very shocked, very surprised. The doctor was very surprised as well. So they remarked that, hey, the flesh was actually growing very healthily. These are healthy tissues, healthy cells, cell growth. In fact, before that, the doctor was already recommending him to undergo a skin graft, where a large chunk of the skin has to be taken up from the back, lower torso, and patch up the gaping wound. But because of the healthy tissue and cell growth, the doctors told him that, hey, you're doing very well. Just carry on whatever you're doing. This is already it is very positive. This is a very positive healing. So this is him on the 25th of July. You can see that his skin is almost growing back nicely, and the size has reduced. And 4th of August, this is him, his wound, even smaller, and healthier cell growth, a healthier skin growth as well. So if you look at the comparison between the 1st of June, when he had this large gaping wound, to the 4th of August, about 2 months. Within 2 months, he actually experienced very rapid recovery, very healthy tissue and cell growth. And now his skin is starting to grow back as well. So this is a very, very, very positive validation of, the fact that someone can get when they take Asea.